Hello and welcome everyone to today's Facebook Live. As always, I'm joined here by Dr. Loren Hamel, President of Spectrum Health Lakeland, and Nicki Britten, Health Officer from the Berrien County Health Department. So Nicki, we will have you kick us off today. No surprise, let's start with the trends that we're noting here in Berrien County.
Yeah, so we have seen a downward trend over the last month or so in the terms of number of confirmed cases, percent positivity, even some hospitalization. So we have been very encouraged by that downward slide. What we are seeing though within the last week or so is that the number of cases is slowly starting to creep up again. It's hard to say whether that means we're on a true upward trajectory that will be sustained or if this is just going to be a little bit of variation at a plateau. But this is a really important reminder that these numbers are fragile and they're prone to, they're very sensitive to changes in how we're living our life. So it continues to be really, really important that people wear their masks, socially distant, avoid close contact with others. We still have a significant amount of community transmission. We're not at the levels we were in November, but we're 3 times higher than how we started October. So while we're in a more comfortable place, we have a little bit more breathing room, we're not as concerned about overwhelming the health system, it doesn't take a whole lot for us to get there. And I think it can be easy to say, okay, we've got the vaccine. We're talking a lot about vaccine. We're hearing a lot about vaccine. Thousands of people in our county have been vaccinated. It's easy to take our foot off the gas and get a little bit lax about some of those things. But I want to encourage everybody to think about the vaccine as more of an investment strategy. It's a long-term investment. We're going to be putting money into that, putting effort, putting vaccines into that account, and we're going to see it pay dividends by this summer, maybe late spring. Right now, we still have to wear our masks, socially distance, avoid close contact with others. I do want to explain one other thing for anybody who's been following trends on the health department's dashboard. A new addition this week has been that we've added probable deaths to the dashboard. And I know we've received a lot of questions about that, just wanting to know what that means. So our dashboard has included deaths among people who have had confirmed COVID-19. And there's a certain definition of what it means to have confirmed COVID-19. It's a certain type of laboratory test that you have to have to fit that confirmed criteria. There's another definition of the probable cases, and that certain rapid antigen tests only yield a probable, not necessarily confirmed case, as well as there's some other epidemiological linkages or clinical symptoms that can cause somebody to be a probable case. Those deaths that are listed as probable deaths are people who died who were probable cases, not necessarily confirmed. As we've seen an expansion of rapid antigen testing, we are seeing more people that hit that probable case definition as opposed to the confirmed. And if they do end up expiring, that's where they would fit on the dashboard.
Thank you. And similarly, Dr. Hamel, if you want to just discuss the numbers that we are seeing at Spectrum Health Lakeland.
Sure, thanks very much, Jessica. So the inpatient COVID positive patients is running just about the same as it was a week ago. And that's really encouraging. Also to Nicki's point, it has been declining and it hasn't really continued to decline. So we're at this little plateau stage and are just hoping that that plateau will turn into a downward trend and not turn into an upward trend. And that depends largely on you. So we certainly encourage you to be incredibly careful. We still are in Berrien County losing one of our residents to COVID-19, them passing away most days. And if you look at the Berrien County county site, health department site, and look at the mortality rate, it's pretty easy to see that since this began, we have lost a lot of our friends and neighbors. About 200 thereabouts when you add the probable cases. I think I'm getting that real close. That might be yesterday's date or the day before, but about 200-ish. And we want that to stop. And if we can do that, and immunizations and good behaviors can help that stop. And so we're hopeful that that trend will start to decline very soon.
We've been in this pandemic for about 10 months now, and so we're starting to get some questions about reinfection and, can people get reinfected with COVID? So what do we know about that?
Yeah, you can. For most viruses, it's possible to get reinfected. Most individuals, when they confront an infection, a viral infection, will make antibodies. Now, sometimes those antibodies hang around for years and years, and sometimes not. And sometimes they hang around for years and years in some, and others not. So it's not at a stage where we can predict who will make an antibody and who will make less, or who will make an enduring antibody, last a long time, and who will have just a transient antibody. But it is possible to get reinfected. Most folks are appearing to have antibodies that are useful to prevent a recurrent infection for about 90 days or so. But it is, it's just an approximate. Anybody who gets COVID-19 needs to assume they can get it again. And that's why it's important to consider that you still need to have all the protections, the mask, the social distancing, the hand hygiene, and it's also very important to take a vaccine. Additionally, some of the folks that get reinfected are worse the second time, not better the second time. And there have been several reports of folks dying on the second infection. And that's a little unusual for infectious disease to get it that soon and to actually get a worse case. So take it seriously, assume you can get it again, make sure you stay protected, and get a vaccine.
We've also heard some news about new strains of the COVID virus. Have we seen that locally, and should we be concerned?
Well, Nicki would tell you we haven't seen them locally, and we would tell you the same thing, but we expect them. Any virus can mutate, and we see that, often with influenza. What we expect in a year is sometimes not exactly what we get in a year, and sometimes that's because of mutation. There have been several mutations. It appears that those mutations are more transmissible, but not necessarily more deadly. And it also appears that we'll have some protection or good protection with existing vaccines. If the existing vaccines we find out over time are not affording the protection we predict or we hope, that vaccine can be tweaked by the manufacturer to accommodate those new strains. I don't expect anybody to tweak a vaccine anytime soon. But over the course of the summer or the rest of the year, if we find that the protection is less than we thought, then I suspect somebody will be considering tweaking the vaccines. But at this point, it is concerning it's more transmissible, but it is reassuring that we think we have protection, some protection.
All right, and let's get to the topic that I think is on everyone's mind here, vaccines. So we began vaccinating some of our community members on Monday. Can you both share just where we're at with this effort, what our main focus is going forward the next few weeks?
Sure, Nicki, you want to go first?
Yeah, so one thing that I really want to just reiterate to everybody is that the health department in Lakeland, Spectrum Health Lakeland, we're working really in lockstep, and we're working for one strategy for our community, and as partners taking the pieces that make the most sense for how we're able to most efficiently serve the community as a whole. We've both been working through those 1A healthcare workers and assuring that the long-term care facilities as those top priorities. Now that we have expanded into eligibility for older adults and a little bit broader professions, we have been doing that. However, I probably don't need to say this to anybody, but demand for the vaccine far outstrips the supply. So we've probably got about 40,000 people that are eligible for vaccination in Berrien County right now, and nowhere even close to that amount of vaccine available to do the vaccines. We do have a wait list at the health department, and right now we have 14,000 people, 65 plus, who are on our wait list. So it's going to take a little bit of time for us to be able to work through that. At the same time that we're starting to vaccinate older adults, Spectrum Health Lakeland is also vaccinating older adults. And we are working to work from similar lists so that if you've signed up in one place or you've signed up in the other, that doesn't necessarily mean that one way is faster than the other. And we're really working together to make sure that we can do this as efficiently and quickly as possible. Just to review the risk factors and where we're prioritizing right now, We are focusing primarily on older adults in that 1B category of new eligibility, as well as first responders and some other professions in that 1B category that are eligible. But we want to have a focus on those who are most susceptible to morbidity and mortality to try to protect the most vulnerable, as we're continuing to also protect the healthcare system by vaccinating healthcare workers as well.
Yeah, from the Lakeland perspective, we have immunized at least first dose and some second doses of our healthcare workers. So just about everybody that wants a dose has had a dose. And we're planning, of course, second doses for everybody that gets the first dose. And we are delighted to have enough vaccine to at least start immunizing the community as well. We gave over 1,200 vaccines this week and have again been just absolutely coordinated with Nicki Britten to make sure, and the health department, make sure we're giving everybody that has signed up in a fair and equitable way a dose. And it's going to take a while to get through that list. Obviously, we are hoping for a few thousand doses this next week. We can't predict that. We don't know that, actually. We're going to ask for more doses than we expect to get. And I hope we're blessed with all those doses. But I'm hoping we'll get a couple thousand doses. And our commitment is to give them all away. Yesterday, we gave nearly 600 shots at one community clinic. And we are planning for capacity of 1,000 to 2,000 in a clinic. So we are going to always be ready for additional supply if we get it. We will never have the constraint where we get way more vaccine doses than we can give away. There's two reasons for that. We want you to have the shot, number one. Number two, if we have doses hanging around, we might get less on the next allocation. And so we want to make sure every dose that we can possibly administer is done every week we receive a vaccine. And we'll plan that for next week as well. But we were absolutely thrilled to see elderly community members queuing up for the vaccine with smiles on their faces and sometimes tears in their eyes, that finally they have something that will help curtail and ultimately stop this disease. So it's really been a blessing to round in those sites and see our friends and neighbors getting their shots.
And I'll add to that, just with some of the unpredictability with vaccine supply. And sometimes we just don't know how much until we receive notification once a week, here's how much vaccine you get the next week. We really don't know. So we are really we are planning far out. I think both the health department and Spectrum Health Lakeland have a good idea of what we want to be planning for the next 6 weeks worth of clinics and how we're ramping up our capacity. But you might not be aware of clinics until a few days ahead of time, because we want to make sure by the time we get to an appointment and by the time you have an appointment scheduled, we're sure you have a vaccine. So if you are on wait lists, if you've signed up either through MyChart or the health department, we want you to be checking your email at least daily, so that when your time comes up, you may not have a lot of time to plan far out. We're not scheduling appointments for first doses at 4 weeks out. It will be somewhat rapid because of the nature of the planning for this. So we're planning for and building the capacity. The appointment slots are becoming available with a few days notice.
Thank you both. And we've touched on this a little bit, but just so everyone is clear, if they're interested in getting the vaccine, what are the action steps that they should be taking right now?
Yeah, I mean, I think it depends a little bit on who you are and what group you fit into. So if it's somebody who's 65 plus, there is a wait list that the health department has, so you can register on that wait list. It is for Berrien County residents. But I think there's also an option through MyChart too, isn't there, Dr. Hamel?
There is. If you have an Epic record and you have a MyChart account, and if you don't have a MyChart account, you need one, because it's the way we can communicate with you and you can communicate back. But if you go into MyChart account and click on My Record, you'll see a questionnaire, and that questionnaire is designed to get you on the list to get a COVID vaccine. We across all of Spectrum have had tens of thousands of people use that. And we've had a number, of course, in Berrien County, but we'd encourage you to go to that site. And by the way, you can go to both. We're trying to coordinate our efforts. So if you have any concern of not raising your hand and having it be seen, you certainly are welcome to go to both. That doesn't confuse us. It doesn't harm your chances any, but just make sure you've completed that questionnaire if you have a MyChart account.
And what I'll add is it's wonderful, and that's fine to be on both wait lists where you have indicated I am interested in the vaccine. What we do want to try to minimize moving forward is, please, we don't want people to book 2 appointments,
No.
one at Lakeland and one with the health
No.
department. That might start to get confusing. And again, as we are opening up appointments with a few days in advance, just to make sure we have appropriate vaccine, we would hate to have an appointment slot reserved for you when you have maybe already gotten the vaccine a couple days earlier at another clinic. If that happens, that's fine. We just want to hear from you so we can get somebody else in your slot and again, be most efficient with our vaccine.
And we'd also encourage you, the phone is not an efficient way to get in line. And so please, don't be calling your doctor, the hospital, the emergency room, the health department. Those tools we've just talked about is the most efficient way to get your name on the list.
Yeah. And if the internet is absolutely not an option for you and you're 65 plus, you can call our hotline at 1-800-815-5485. Our hotline team has been quite overwhelmed with call volume recently. We're working to try to increase that call volume. But if that truly is your only option, you do have that option. But for everybody who can register via the internet, we are asking that you please do so.
And if you have a friend or relative or neighbor that qualifies, that you think has a challenge with digital connection, internet connection, please help them out.
Yeah.
I mean, help each other out on this to make sure that we get everybody that wants the vaccine on the list.
And speaking of some of those underserved populations, how are we ensuring that some of those different areas are still getting access to the vaccine who may not have access to some of these traditional communication mediums?
Yeah, I think that's a really important question. And between the health department and Spectrum Health Lakeland, specifically the population health department, we're actually forming some rapid response community teams that are based one in Benton Harbor and one in Niles, because we know those are 2 areas that have been disproportionately impacted by COVID-19 and may not have as ready access to some of the mainstream methods of gaining healthcare, whether it be to the internet or healthcare access, lots of different things. So we are working to pull together some community members to help influence what those strategies look like. And collectively, we are trying to carve out a proportion of our energy in our effort to make sure that we are outreaching to individuals that may have difficult through some of the traditional mechanisms of getting on a wait list or registering for an appointment. So we're definitely trying to acknowledge all of the difficulties. A one-size-fits-all approach does not work for everybody, and to try to carve that out while at the same time trying to be as efficient and work as expedient as possible. But there is a lot of effort underway to make both of those things happen.
Agreed.
And there has been some recent media reports of concerns that they're pushing out the vaccine that was originally held back for second doses. So does this mean that people may not get their second dose, or how are we managing that?
Yeah, this is complicated, and it's not a short answer, but I'll give you at least my quick answer. As Nicki said, the demand outstrips the supply, and some of the supplies we expect to get, we don't get. And we're doing everything we can to schedule rapidly at a time when we know what's in hand and we can give you a dose. On the other hand, we have second doses from 3 weeks ago or 4 weeks ago, depending on whether you get a Pfizer or Moderna vaccine, that we want to make sure is available. It is possible that you'll get scheduled for a second dose and will not have it. I hope that doesn't occur. The manufacturers are trying to prevent that. Everybody's trying to prevent that. But we could get in a situation where we just have markedly more demand than we have supply. That's not going to spoil your immunity. We'll give you that dose the minute we can. You don't have to lose sleep over that if that happens. And again, we're trying to prevent it. But you're going to see reports around the country, I am sure, where that occurs, where somebody doesn't get that second dose on time. And we're trying to prevent it, but it might happen here as well.
And just in terms of the ordering process and how we're tracking that, we are tracking people's first and second doses. So we know who needs a second dose. We know how many second doses we need, the timing of that. And the way the vaccine is ordered or requests are at least put in is we need X number of first doses, we need X number of second doses per manufacturer. So there are those tracking mechanisms in place. We are doing everything possible to make sure that that vaccine is available for the second dose. And to Dr. Hamel's point, 21 days or 28 days is the first day you're eligible to get your second dose. It doesn't have to happen exactly on that day. If there's a little bit longer of a gap between the two, that is still okay. Again, we're trying to minimize that happening though.
And as Nicki mentioned at the beginning, even though vaccines are here, we still have a long road ahead of us. Can we share what we know about disease transmission and immunity in regards to the vaccine and what steps we need to continue to take?
So, I mean, as we said earlier, a lot of our, tried and true methods over the last 10 months of the social distancing and the masking and the avoiding large gatherings and close contacts with other people. That's still the bread and butter of COVID-19 life. And we need to make sure that we're continuing to do that good hand hygiene in there as well. As I said before, vaccine, we need to view it more of an investment. Maybe this is our retirement income that we're planning for in the future, and it will pay dividends for us. It will come to fruition in several months' time. But right now, we got to stay focused on what's at hand with those tried and true measures that we know work. We're all tired of them, but we know they work, and that's what we need to continue to be diligent in.
Nicki, might you, I'm going to borrow your role here for just a second, Jessica. Nicki, might you make us a comment on what the governor made comments on about expanding sporting events and hoping restaurants? I'm sure our friends and neighbors have heard some of that.
Yes, so there was a change to the epidemic order modification. The epidemic orders we had been operating under do sunset January 15th. So new orders have been issued that will be effective January 16th through the 31st. This does allow for basically any activities that are happening indoors where people can be masked and socially distanced can happen. I know there's a lot of stress and strain about the fact that indoor dining is not one of those activities included because it cannot be both masked and socially distanced. Sports can resume, but obviously contact sports have to be done in a way that there's no contact because we are looking to maintain social distance there. So MDHHS has some good FAQs and some infographics and just one-pager summaries explaining what is okay under the new epidemic orders. We're also understanding that there is, for the until January 31st, there will be some details coming out of the state about some steps that restaurants and bars will be expected to take as a bit of a path towards reopening for indoor dining. So that gives us some encouragement that come February 1, indoor dining may be available in some capacity. The details about what that might look like and what some of those requirements might be, we've been told should be forthcoming over the next couple of days. Is that what you wanted me to cover?
That's beautiful.
All right, thank you both. Well, that concludes our main questions that we had for you. If you just want to share any closing thoughts before we wrap up today.
I'd love to. I would like to, on behalf of the 4,000 team members at Spectrum Health Lakeland that are in the business of trying to protect your health and to save lives in our community, thank you from the bottom of our hearts. I appreciate your interest. I appreciate you tuning in. I appreciate your willingness to be careful with mask and hand hygiene and social distancing. I appreciate you encouraging others to do the same. Thank you for thinking hard about a vaccine, and God bless you. I hope you take it. I've taken mine. We just want everybody that's eligible for that vaccine and everybody that will take it to take it. I appreciate that so much. If we do this together, we do this united, we're going to have a great outcome. And I just hope and pray for that. Thanks so much.
Yes, and ditto from the health department. Public health is a team sport, and an important member of that team is the community. And everything we do in public health is in service and in the interest of the public. And again, to reiterate what Lauren was saying, we share all of the same sentiment of we're very grateful for all of the actions and the sacrifices and all of the things you're doing to help protect the health of our community. We really all are in this together.
Thank you everyone for tuning in today. And as always, we encourage you to continue to watch our Facebook pages and also spectrumhealthlakeland.org and the Berrien County website, bchdmi.org, as well as vaccinatewestmichigan.com are all great resources as this continues to change and evolve.